Am I eligible for hair transplantation? After hair transplantation, will any shock loss come to me?
Thank you for your question. Your question has two parts. One is, are you a candidate for hair transplantation? And two, will you develop shock loss? So the photos you've submitted are actually very good and gives me a very good sense of what level of hair loss you have. What you didn't include in your question is your age and the rate of your hair loss progression, as well as what type of result are you expecting from a hair transplant. But I'm going to make some assumptions because I think that after 20 years of doing hair transplant surgery as a board-certified cosmetic surgeon and doing all types of different surgeries, that I can certainly get a sense of what you want. And usually when patients come to us, they want all their hair back and they want to cover up everything. So let's start by understanding what your situation is, and maybe we can just work with certain assumptions since this information wasn't provided. First of all, if you are younger, and when I say younger I mean under 35, and you've had a relatively rapid progression of hair loss, then you have to understand that a hair transplant does not stop hair loss. A hair transplant is a very straightforward concept. It's taking hair from the permanent zone which is not subject to hair thinning, and that's that narrow band of hair that you see in the man who is the baldest man you've ever seen, is a narrow band. That's the permanent zone, or otherwise referred to as the genetically resistant area or the donor area. These hairs are not subject to hair thinning. Therefore, they can be transplanted, moved from one place to another. Now, the math simply doesn't work to cover up an entire scalp with that donor area. So if you look at people who have had hair transplants, where do they mostly have their hair grafts? In the front. The idea is to frame the face and to put the grafts in a place where it will allow the face to be framed. When you're younger, you want lots of hair. As you get older, in 40s and 50s, more than 40 to 50% of your contemporaries don't have a lot of hair. Therefore, it's okay to have hair loss, socially and otherwise, and be able to handle a limited amount of coverage. What we have done in our practice is we've actually created an alternative to hair transplant we call hair regeneration as a way to treat hair loss without a hair transplant. But before going further into that, also to understand is, what are you doing to stabilize your hair loss? Are you using any medical therapy? Are you using Finasteride? Are you using Minoxidil? These drugs, there's plenty of information about them out there, and unfortunately with Finasteride, a lot of men, especially those who are coming to see us, don't want to take Finasteride out of fear of long-term sexual side effects. So it really limits your options for stabilization. The hair regeneration treatment we've developed came out of a stem cell-based wound healing technology. And what we've been able to successfully do is, without depending on Finasteride or Minoxidil, do an injection into the scalp that stops the progression of hair thinning and now allows the hair to become thicker. We have approximately 5 years of data. We have hundreds and hundreds of patients coming to us from around the world who we follow very, very closely. We see our patients every 3 months, and I can tell you, having done hair transplant for 20 years, that the results of hair regeneration in the right candidates far exceeds not just 1 but 2 hair transplant surgeries. Nature already has the hair in place. It just needs to get thicker again. And when it's thicker, the density and the coverage really can be impressive. So understanding that you do have an alternative, and you should explore options with medical therapy as well as new technologies such as hair regeneration. To address the question about shock loss, I can say that shock loss is intrinsically a part of every hair transplant surgery. When you are creating trauma to the scalp from surgery, where you're making thousands of incisions and you're having a 7 to 8 hour surgery on average, you're going to have what's called telogen effluvium, or shock. Doesn't mean that you've lost the hair permanently, but it does mean that there will be loss of existing hair. So you can look worse before you look better, and that's one of the big negatives of transplants. Transplants are very often oversold, and the limitations are understated. So the limitations of the donor area, the presence of shock loss, and the amount and the density and yield of transplants have made transplants very frustrating for both patients and doctors. And so for us in our practice, hair regeneration has been this remarkable godsend to help patients who are experiencing progression and are frustrated even after they've had hair transplant done elsewhere and they continue to thin. We've helped people who have been able to avoid a second transplant. We've helped people who, while they're healing from their transplant, have come in to have the injection to help them heal the grafts and the donor area, and it seems to accelerate the healing process. So it really is remarkable. We're kind of entering a new age of medical care, which is stem cell based, and interestingly, this is your body's own adult stem cells. It has nothing to do with fetal or otherwise external stem cells. It's from yourself. So in summary, explore other options. Yes, shock loss can happen to you if you choose to have a transplant, but get more information before you move forward with a transplant. So I hope that was helpful. I wish you the best of luck. Thank you for your question.